Most people think heart attacks come out of nowhere. They don't. The moment is sudden, the disease is not. And that misunderstanding is why so many people are shocked nothing ever felt wrong before they realize some options are already gone. When someone says a heart attack came out of nowhere, what they're really describing is the first moment their body could no longer compensate. It was holding things together until it couldn't. That's the difference between the disease and the event. The disease builds quietly over years. The event happens fast. And if you don't understand that difference, you end up trusting the wrong signals. Heart disease does not start with a heart attack. It starts much earlier inside the arteries, long before pain, and long before warning signs, and long before anything feels off. The scary part is not how dramatic it is, it's how long it can be happening without you knowing. Because if you're waiting for symptoms to tell you something is wrong, you are not catching disease, you're responding to damage. By the time symptoms show up, the process has usually been going on for years. Symptoms show up late, they are not an early warning system, and this is where people get blindsided. Most heart attacks do not happen because an artery slowly closed over time. They happen when a plaque that's been sitting there quietly suddenly becomes unstable and triggers a clot. That is why people are shocked, not because nothing was happening, but because they did not know what they were supposed to be looking for. So if heart disease is not sudden and symptoms show up late, the real mistake is assuming silence means you're safe. The better question is, how do you see what is happening before your body forces the issue? This is where most people get misled. They assume routine blood work tells the full story. It does not. Routine labs usually catch problems after they have already made themselves obvious. They are not designed to spot slow-moving trouble that is flying under the radar. Routine blood work is like a check engine light. It usually comes on after something is already wrong. Helpful, but late. If we take a deeper look at heart disease, instead of asking is something wrong, ask is something quietly building. Not just your cholesterol numbers, but what have your arteries been exposed to over many years? Risk adds up. It's not one snapshot, it's what your arteries have been soaking in over time. Second is acceleration. Two people can have similar exposure and end up in very different places. Why is that? Because something speeds up the process. Things like insulin resistance, chronic inflammation, blood pressure changes, and metabolic stress. You usually don't feel these either, but they quietly turn slow plaque into unstable plaque. This is where I eat pretty well and our exercise sometimes stops becoming very useful. Because this part is not about effort. It's about what your body is actually doing. And unless you're looking for it, you will not know it's there. And third is evidence. This part gets misunderstood a lot. Evidence does not mean disaster. It means asking has damage already happened or not. This is where imaging can change the conversation, not because it predicts the future, but because it tells you whether the past has already left a mark. You can feel fine and still have early disease. You can also have risk factors and no measurable damage yet. Those are very different starting points, and most people do not know which one they're in. Here's the shift. Heart disease prevention is not about guessing. It's about being able to see clearly, not panic, not obsession, just clarity. Once you understand what you've been exposed to and what might be speeding things up, and also determining whether there's any damage already there, decisions get calmer, not louder. That's the difference between hoping and actually managing risks. Your doctor is not your investigator. They are the consultant. Better information leads to better conversations. The goal is not to demand more tests. It's to say, here's what I want visibility into. Here's what I'm trying to avoid. And here's what I want to keep an eye on over time. That changes everything. Once you see heart disease for what it really is, a slow, quiet process, prevention stops becoming mysterious. It stops being about chasing the perfect diet or the perfect supplement or the perfect routine. It becomes about managing risk. And risk management starts with one idea. You cannot manage what you cannot see. Heart attacks feel sudden because people misunderstand the disease. But heart disease itself gives you time if you're willing to look. The mistake is not aging, and it's not genetics. The mistake is waiting for symptoms to tell you what you should have been paying attention to all along. If there's one thing to remember, it's this. Heart disease does not punish people who care too early. It punishes people who find out too late.